Solidarity forever.
Meru health workers are complaining of mistreatment from the county government just a few months after the general election. The health workers claim that efforts to reach Governor Kawira Mwangaza for talks have not borne any fruit since her handlers are not according them the opportunity.
There's a lot of outcry amongst ourselves because of the issues that are continuing in the department. One, we have issue of insurance. We have a lot of challenges when we are going to seek for medical attention because the insurance that we have, it has got a limitation of 1,500 per visit.
The reason why we are coming here today is because we have tried all means, writing letters one after the other, requesting for a meeting so that we can solve emerging issues. We must agree there are issues for a long time ago, but now those are emerging issues, particularly insurance cover. The one we had previously was doing very fine, and the healthcare workers were very comfortable. But this one was independent, the higher class and the low class. There are those who have the cover, comprehensive cover, and there are those who doesn't have. Now, Meru County, tumendipendiwa mara mbili.
Some must travel from all the way from Mutuate to Meru to get health services, which is dangerous. So to us, as healthcare workers, we are requesting for a meeting with the governor so that we can be able to know how to handle these things.
What we are highly suspecting, most probably, is that the people that we give letters, they either don't share with the governor or they usually distort the information, and therefore the governor does not understand the plight of workers.
They also say that some of the colleagues have contracts that are running out, but the concerned department is not acting on them, which will affect the health services in Meru County.
We have other challenges like promotion. We have other challenges that even are cropping in where the realignment of the department has been done without consultation of the workers. With so many people, actually administrative is even more than the people in the clinical areas because we have over 200 people in the administrative part, worsening the situation of the shortage that we have because so many people have been removed from the clinical areas, taking them to administrative works.
We need a constructive meeting, a very clear meeting, because we have requested these meetings for quite some time now. And we need to have a sober way of doing things. We have no any war with the governor, and we don't want the stories to reach to the governor when they are distorted.
So what we are saying in a nutshell is that the workers of this county, they are adversely affected with the current state of provision of health services in Meru County. And particularly, what we are saying is that workers cannot afford the health care services, especially the low job group workers. They cannot afford for these services simply because the changes or the provision which is there within the cover, it is not something that does not warrant this officer getting the enough services. We also think that these workers have not received promotions, some of them for very many years, and we are saying for a large extent we've been sending letters to these offices seeking an audience with the governor, but this one has not been forthcoming.
The complaints come a few weeks after a serious discrepancy that dogged the county assembly and the county boss Kawira Mwangaza, leading to an impeachment motion and later impeachment hearing at the Senate. Kind of Stefano, Ebre TV.